What happens when Medicaid goes away or gets cut? So in Lehigh County, we have a nursing home that's primarily funded by Medicaid. I'm the controller of Lehigh County. Last year, I signed checks for about $90 million in order to keep our nursing home open. Our nursing home has about 670 beds, so 670 people. So if there was a 10% cut, which is currently what's being suggested, or an 11% cut is actually what they're suggesting, that would mean that 67 people would be displaced out of our nursing home. Or alternatively, there would be a cut across the board, meaning that we would get paid less for every single bed, and that would make it unprofitable. So we would have to, potentially close the entire nursing home, increase taxes, or go back to the families to get them to fund the rest. So I think the important thing to keep into consideration going forward is, so while they may be trying to find efficiencies at the federal level, when that comes down to the local level, there will be an impact. In this case, one of the impacts would be our nursing home, which will be underfunded. And so eventually we will either need to shut the nursing home, reduce the number of people in the nursing home, or the public is going to have to pay those increased costs. And, we're talking in the order of, $10 million or something along that line. That would either be shared amongst the entire community, or it would go back to individual families, but the likelihood of the individual families being able to pay for it is seemingly unlikely. In any case, I'm just trying to inform you as to what might happen locally if Medicaid gets cut. I also want to make sure we're clear on what Medicaid is versus what Medicare is. So Medicare with the E on the end, you can kind of think of that as E for elderly. So that means, they're past 65 years old. Sorry that you're elderly at that point. But nevertheless, you're past 65 years old and you're sort of entitled to some benefits at that point. Medicaid, with a D on the end, is for the disadvantaged. So these are people that have typically no money or an inability to pay for their nursing home themselves. So Medicaid is for the disadvantaged, Medicare is for the elderly. Medicaid is what we're talking about, the cuts for Medicaid for the disadvantaged. Thank you.